But welcome everybody to MJHS's Vet-to-Vet Café program. Today's installment is Music as Medicine, where we will take a deep dive into the history, the science, and some storytelling about how this artistic intervention has benefited veteran patients on hospice. And we're also going to have a live performance from one of our talented music therapists. And it's a real thrill and a privilege to be welcoming our panel of guests today who are part of the MJHS Creative Arts program. And for this webinar, the chat and camera features have been disabled, but that doesn't mean we don't want to hear from you. Please post questions that you have throughout the program and the Q&A feature, and we will have time toward the end of the program to address those questions. And also, as you heard, that we are recording this, it will be archived on the MJHS YouTube channel, which is at MJHS01. And with that, I would like to thank MJHS and Toby Weiss, my supervisor, and for her leadership and mentoring, and also TD Bank for their generous support for the We Honor Veteran program. And I'm going to turn it over to Toby now. Thank you so much.
Thank you, Ashton. Thank you all. Thank you all for coming, and thank you for our incredible team led by Marguerite Metzendorf. We've been working together a long time, and the integrative therapeutic interventions such as music therapy are magical moments. It's like if you ever experience a patient intervention led by the music therapist, it's not just heartwarming, the vibe changes in the entire setting. And it helps in so many ways. We're celebrating Women's History Month, and we're celebrating as well this month Vietnam Veterans Day. And I can't think of a better mix, because we have seen so many situations in which the veteran and or their family members have a bit of a challenge when it comes to communication, reconciliation. And when a music therapist comes and does their magic, there's really it really is a magical moment. The opportunities for reconciliation, for sharing of history, of gratitude, it's simply incredible. And so I from my own heart, I want to thank you all for what you do on a daily basis, and Marguerite for your leadership in this area, and Ashton, thank you for all you do. You have upped the ante for MJHS in our ability to serve veterans and their families in the most incredible way with person-centered trauma-informed care, and your ability, your passion to help people get the benefits and the needs that they have met. We owe you a debt of gratitude. So I turn it back to you. And thank you again all for coming, and let's just enjoy this session.
Awesome. Thank you so much, Toby. First and foremost, we are very grateful that you're all taking the time with us today. And so just to learn a little bit more about you, I'm going to launch a very short poll just to learn a little bit about who you are, and if you're veterans, and if you're working with veterans. So while that's taking place, I'm getting ready to share the bios of our panel, but we also want to just commemorate the fact that Toby, as she mentioned, it is we have National Vietnam Veteran War Veterans Day coming up on the 29th. It's also National Social Worker Month, and it's also Women's History Month. And so we want to thank our social workers who do so much to support families. You are the people who truly want to help out others, and you should be celebrated every day. So it's nice to have an opportunity just to thank you for the great work that you're doing. National Vietnam War Veterans Day is coming up, and MJHS will be commemorating this somber anniversary by honoring a Vietnam veteran who is on our panel, who's admitted to our hospice program not long ago, with a private veteran recognition ceremony, where he will be presented with a special proclamation signed by Governor Hochul, a We Honor Veterans certificate, and a letter. And we're going to continue counseling him and his family about veteran benefits that they are eligible for. And we're going to take part in the reading of the names ceremony that has been rescheduled. It was supposed to take place last Saturday, but was postponed due to the inclement weather. And just a little bit of history here. There were over 2.7 million who served during the Vietnam War in active duty. And of those folks, more than 265,000 were women. and they served in the military, and 11,000 served in Vietnam, with 90% volunteering as nurses to train Vietnamese women in nursing skills. Several lost their lives, including one that we're going to talk about in a second, during the conflict, who were posthumously awarded for their courage and bravery. Veterans like First Lieutenant Sharon Ann Lane, who died from shrapnel wounds when the 312th evacuation at Chu Lai was hit by rockets. Sharon was posthumously awarded with the Vietnamese Gallantry Cross and Palm and the Bronze Star for her heroism. And in 1970, the recovery rooms at the Fitzsimmons Army Hospital in Denver, where Lieutenant Lane had been assigned before going to Vietnam, was dedicated in her honor. And in 1973, the Altman Hospital in Canton, Ohio, where Lane had attended nursing school, erected a bronze statue of her, and the names of 110 local servicemen killed in Vietnam are written on the base of the statue. So if you would, just take a moment of silence just to acknowledge all those that we lost during this brutal war in Vietnam. Thank you so much. And just two items worthy of mentioning. MJHS headquarters recently moved to 55 Water Street, and that is the same address. We are adjacent to the New York Vietnam Veterans Memorial Square Plaza, and that is a huge honor. And there's also a New York State Women's Memorial that honors women in military service over the past 200 years. And this memorial is on Madison Avenue near the New York State Museum and was dedicated in 1998. The memorial serves to educate the public on the role of New York State women in the armed forces, past, present, and future. And currently, women make up 14% of the active duty military force. Of the more than 1.2 million veterans, over 61,000 live in New York State. So I'd encourage you both to pay a visit to those moving tributes to our nation's heroes. So let's get to know who we have on our panel today. First, we have Marguerite Metzendorf. She is the Director of Integrative Medicine and Bereavement Service for the MJHS Hospice and Palliative Care, with direct responsibility of oversight of the Creative Arts Therapy and Bereavement departments. Ms. Metzendorf's vast experience enables her to provide clinical supervision of all aspects of bereavement care, promoting the utilization of integrative therapies to enhance quality of life for terminally ill patients. She strives to bring in innovative and culturally diverse programs that include assessment and individualized care plans to best address unique aspects of complicated grief. Ms. Metzendorf holds a bachelor's degree from Stony Brook University, home of one of our state veteran nursing homes, and social work, and a master's degree in social work from Adelphi University. She's acquired a certificate in alcohol and addictions counseling, certification in thanatology, and she is a certified clinical trauma professional. Ms. Metzendorf is trained with PCTI and has participated in the development of care approaches when working with Holocaust survivors at the end of life. And throughout her 30 years of experience, she has served as a director of social work for a variety of settings, which include home health care, skilled nursing facilities, hospitals, and outpatient mental health. She continues to fulfill her role as a SIFI supervisor, enabling her to mentor social work and mental health counseling interns annually. Ms. Metzendorf receives personal satisfaction supporting the development of future counselors, including bereavement and complementary therapies such as music and art. We also have Charlotte Burton, who has provided community-based hospice therapy in Brooklyn for over 15 years. Charlotte received her undergraduate and graduate degrees in music therapy from Temple University, where her training focused on using music as a psychotherapeutic modality. Following an internship at Memorial Sloan Kettering Cancer Center, Charlotte spent 2 years providing music therapy at an inpatient psychiatric treatment facility before making the shift back to working with terminally ill patients and their families in hospice. She is currently the clinical training program coordinator for the Creative Arts Therapy Department at MJHS Hospice and Palliative Care, providing direct supervision to music therapy interns and training to other supervising music therapists at MJHS. Charlotte has presented her work of advocating for the regular inclusion of the music therapist as part of the interdisciplinary hospice team at several conferences and in webinars, and has published works on the importance of cultural sensitivity and awareness in music therapy. She lives in Brooklyn with her husband and 2 children. Yuzuko DeGrutoli is a board-certified and licensed creative arts therapist who has provided community-based hospice music therapy throughout New York City for the past 16 years. Yuzuko received a Bachelor's of Music and Performing Arts degree in vocal performance at the Shizuoka Gakuen College of Music in Kanagawa, Japan. And her graduate degree in music therapy is from NYU. Following a student internship at Memorial Sloan Kettering Cancer Center, Yuzuko began her career in palliative care. Yuzuko has a long history of hospice care service, getting her start with a palliative care team at the St. Vincent's Hospital and working for several years at Hospice of New York. Over the past 4 years, she has worked for the Creative Arts Therapy Department at MJHS Hospice and Palliative Care, providing direct patient care to specialized groups that include Holocaust survivors in Long Island and Queens. And she is a mother of 3 girls and an avid marathon runner who has completed races in Chicago, New York City, Tokyo, and Big Sur, California. Danielle Lucier has been interning at MJHS since September. She has a BFA from Emerson College and is planning to graduate with her MS in music therapy from SUNY New Paltz in May. When not in school or interning, she can be seen performing around the tri-state area in vocal groups and in wedding bands. And without further ado, I'm going to pass it over to Marguerite. Thank you so much.
Well, it's so really wonderful to be here and to be part of this forum today, to acknowledge the many contributions of our veterans and also to recognize the achievements of the We Honor Them Veterans program. It really has enhanced our care here at MJHS, providing end-of-life services. And I'm really happy that we're taking this moment to draw our attention to the remarkable healing power of music. Music is medicine, and we see it firsthand here at MJHS when we can see through music that someone can come out of themselves when they're engaged in music activity, just to shift, maybe their sorrow or their pain through that experience. We all know that, music has a universal appeal, which makes it possible for every individual to relate to music and to participate in music therapy in a very meaningful way. Music, uniquely allows us to kind of tap into our emotions, and, it helps to change and shift our moods. So it brings solace also when we're going through a difficult time. Research continues to show us that listening to music can improve someone's mood. It can reduce pain and anxiety. So for us here, we see that it enhances the quality of care, and it's really important, music therapy, as a component of hospice programming. At MJHS, we're lucky enough to be able to provide these services. And currently we have 5 full-time music therapists, and we have 1 part-time music therapist. We also have some other complementary therapies such as art and child life specialist. All of these trained professionals go out into all the 5 boroughs as well as Nassau County to visit our hospice patients and veterans. They do so whether it's a nursing home, a group home, it could be an assisted living or someone's private home. And one of the important things that people don't realize is that these complementary therapies is not something that insurance is really pay for or recognize. And even in our traditional Medicare hospice benefit, it is not something that's paid for. So it leaves a lot of hospices, to rely on fundraising, grants, and as well as charitable donors to help support these most important services. At MJHS, I have, this direct ability to provide oversight to these creative professionals, and I get to see the beauty in which they bring to the lives of so many of our patients. These are very skilled individuals. All of our clinicians have master's degrees in music therapy from an accredited institution. Additionally, music therapists often pursue a certification through the Certified Music Board of Music Therapy, which means that they continue to do clinical work and do clinical training, and they pass a board exam. And in addition, into New York State, they're required to obtain a licensed, it's called an LCAT, a licensed creative art therapy licensure. And again, you know, that they have to do additional postgraduate experience in the practice of creative arts therapy, which expands their scope of therapeutic service. You know, our team of music therapists are part of our interdisciplinary team. They meet weekly to address the goals of each patient as they identify that in the team group. And, you know, the music therapists share their talents with our patients and families, and utilizing evidence-based clinical applications of music to achieve these individual goals of care. So perhaps a goal may be to help, you know, decrease someone's pain or anxiety, or to better regulate someone's mood, or to help encourage an emotional release of feelings, and so on. Music therapists really focus on the patient or the veteran's strengths. They look towards their interpersonal skills. They will validate and promote and increase communication and foster moments of self-expression to increase these positive experiences in real time. They use so many different techniques and methods, such as, you know, music-assisted remedies, life review, songwriting, improvisation, singing, instrument playing, guided imagery. And that's just to name a few, and that helps to treat the needs of veterans and their families. Music therapists often, you know, when working with veterans, you know, help provide a unique way for them to express, you know, beyond what normal language, beyond what words can do through the music. It helps create, you know, a safe place for them to feel comfortable, to reminisce about moments of their bravery, or perhaps, you know, their brotherhood, or being amongst their comrades, to find peace, you know, amongst the chaos, or to give a sense of control. Again, you know, one of the other things that we often see with our veterans is that, you know, they carry the burden of their, you know, the weight of their memories, of the trauma, of the loss that they've been exposed to, and they carry this forward. And we see, especially towards end of life, that this increases. So again, the ability to have music at bedside to help with these struggles and these feelings of sorrow, the music can transform. It's transformative. It provides for solace and for opportunities to heal that pain and suffering. You know, one of the other things that we often see too is that our music therapists are very instrumental in doing legacy work. Often, again, it's an opportunity to create a place where maybe they could tell their story, have an opportunity to be validated and acknowledged for their service, their sacrifice, for the things that of which, you know, no other person can relate to if you haven't been in that position. So again, through these legacy opportunities of sharing their story and being validated, it's an opportunity to be, you know, supported in an environment with others. Sometimes we're able to also bring forth the family into these type of music sessions as well, and it gives an opportunity for the families to see another side, or to deepen that connection where they can bear witness to their loved ones, to their veterans' character and their wisdom and their fortitude. And we see often these mutually shared music experiences really can be very healing to the soul. So there's so much benefit to what the music therapist can do. And I think today we're going to be able to hear some of these examples and also to give some of the context of the history of how music therapy was developed, especially in hospice and palliative care. So at this point, I would like to introduce Yuzuko Degoli, who's one of our music therapists here. She is an exceptional therapist who many look for because of her expertise, her knowledge, just her compassion at bedside. So I'd like just at this moment, if I could, to introduce.
Thank you, Marguerite. Hi, good afternoon, everyone. My name is Yuzuko. Today, I want to talk to you about a little bit of history of music therapy. I'm not going to bore you with the history lesson here, but when we were trying to get together this presentation, I realized that as a music therapist, it's a common knowledge that music therapy was established at the beginning. It was all for the veterans' care. And Ashton mentioned that he had no idea. So I thought this was an appropriate time to talk about the history of how music therapy developed as a formal profession. So using music for healing purposes has been around for a long time, as you know. In ancient Greece, philosophers like Plato thought that music could influence our emotion and even our health and well-being. In recent years, which is already about 80 years ago during World War I and World War II, musicians started playing for soldiers who were injured or traumatized. They noticed that music could really help these soldiers feel better and cope with their experiences that was traumatic. This led to the development of music therapy as formal profession. After the war, as you can imagine, many soldiers returned home with deep emotional scars, struggling to cope with the trauma they had experienced. In response, community musicians, at the time often women, which is interesting because a lot of music therapists nowadays are female dominant, began to visit hospitals and community center to play music for these war veterans. What they observed was remarkable. The music seemed to have a profound effect on the soldiers' physical and emotional well-being. It helped to alleviate their pain perception, reduce anxiety, and improve their overall mood. I use the term, a word, pain perception purposefully here because pain is subjective, right? So the degree of pain a person can experience can depending on, to a great extent, on their emotional and psychological states. So music or music therapist support and helping to alleviate the psychological pain often changes the degree of physical pain the person experiences. These observations sparked a deeper interest in the therapeutic potential of music. Researchers and practitioners to study how music could be used as a tool to heal and support those suffering from psychological trauma. This period marked the beginning of what we now know as music therapy. One of the most significant development during World War II was the establishment of the first music therapy college training programs. The first music therapy program in college here in the US was formed in 1944 at Michigan State University. This marked a pivotal moment in the field of transition from volunteer music-based musician involvement to a more structured and professional approach. I remember 2003, this is my personal experience, but in Japan, we didn't have higher level training. The music therapy was some specialized school or 2-year certification classes. There was no college degree or master's degree, not that I definitely not master's degree. That's how I was interested in more of a deeper training, and how I came here to this country in 2003. So today in New York State, music therapists are required to hold a master's degree in music therapy to become state licensed. This is in addition to obtaining the board certification as a music therapist. The inclusion of music therapy in veterans care not only highlighted the growing recognition of its effectiveness, but also laid the foundation for the profession we know today. It was driven by the desire to help those who had sacrificed for our country. Before I hand this over to Shala, I quoted this Maya Angelou's quote that it's my favorite. Oftentimes we work as a music therapist, words fail. A lot of people's recognition, cognition is declining, and a lot of patients that we deal with are nonverbal. But what we convey through music is, I am here for you, and I support you, and I'm present for you. So this is the quote by Maya Angelou. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. So I always remember that as a music therapist. Now I'm going to hand this over to Shala, who's going to talk to you about the example of music therapy for veterans care. Thank you.
Thank you so much, Yuzuko. That was beautiful. And thank you, Ashton, for asking me to do this. I've definitely, in working at MJHS, I've treated several veterans over the years, so I did want to share with this audience a few case examples, a couple of case examples. And just to kind of recap in thinking about hospice itself as patient-centered care, this is really why music therapy fits so well into hospice, because music therapists are treating the patients, and in hospice it's the patient and families in such a holistic way, you know, trying to meet in a multi-symptom approach across all the domains of care: physical, cognitive, emotional and psychological, and also spiritual. So music can kind of touch on all of these things. And I thought it'd be a great opportunity for me to share with you a couple of case examples. So first we've got, I'm going to tell you a little bit about him, a patient who I worked with for nearly 2 years. And as the music therapy intern supervisor, I also had the pleasure of supervising one of our interns working with him over this extended period of time that he was on our program. So he was an 85-year-old Korean war vet, I believe, with end-stage lymphoma. He had a history of a stroke that had happened about 20 years before he was on hospice. So this had left him with the right-sided hemiplegia, inability to use the right side. And then he had a pretty impaired speech, which then was worsening as he was approaching end of life. So the referral was made by the social worker, I believe, a few months after his admission, because of his communication not only was impaired by his speech, but she felt that he was also depressed and was just kind of withdrawing into himself as he approached end of life. And he wasn't able to make his needs known to his family and his wife, who lived with him, especially. So that was frustrating to her and to the family as well. He was having increased shortness of breath, and mostly using oxygen at night at the point in the video you'll see. But he his pain was well managed with medication. And he was referred to music therapy because his wife, Lorraine, identified that he had always liked to sing. And she felt, she was very upset about his just inability to speak anymore, or kind of his withdrawing, not wanting to speak anymore, and thought, well, maybe we could try music therapy and see if that will help him to kind of come back to himself. Music had always been integral to his life. He would sing around the house. She would tell stories about the two of them as, a young couple going to sing at like the local diner with the jukebox. Just lots of great memories that surrounded music in their lives. And I want to show you. So after hospice was introduced, and music therapy was introduced, they discovered that he could still sing. And I want to show you here, just give me 2 seconds to pull the video. Okay. So this is our intern, Jenny, with Charlie singing one of his favorite songs.
Earth angel, will you be mine? My darling dear, love you all the time. I'm just a fool in love with you. Earth angel, one I adore. Love you forever and evermore. I'm just a fool in love with you. I fell for you, and I knew the vision of your loveliness. I hope and I pray that someday I'll be the vision of your happiness. So, earth angel, please be mine. My darling dear, love you all the time. I'm just a fool in love with you.
So as you heard there, that was his wife, who was kind of chuckling in the background. But as you could see, the music therapy really did change, as Toby said, change the whole vibe of their home. He began to, every week when the music therapist would come, he would just, his wife would tell us his whole mood would change just in anticipation of the music therapy visits. And as you could see, at this point, he couldn't really speak clearly, but he was able to sing, which was remarkable, and is not unusual with music therapy. We know whatever part of the brain the synapses just connect when singing, and music therapy is actually used in speech therapy quite commonly, because it does assist with kind of reconnecting those nerve endings. But yes, so we worked with Charlie for quite a while, and as time went on, he did increase, the shortness of breath increased. He became more fatigued, but his connection to music was always there. Even when he wasn't able to sing anymore, he could hum a little bit, or he would just listen and would maybe kind of tap a finger on the side of the bed rail. It was really just something that changed the entire household, and the way that he responded to the music after so many months of really suffering from depression and not having much to look forward to. The music kind of just changed all of that. So that was a really remarkable case. And then, of course, with hospice, we continue to provide services to the family, and his wife was able to then engage in some of the bereavement work that we provided after his passing, and always noted the music therapy was such an important part of their experience. And of course, now that we're so Marguerite mentioned the legacy work. Now that we're so able to record things, we had these beautiful recordings that we could also share with her, which gave her, these lasting memories after his passing. So really, really such an important case. And if I have time for one more quick video, I wanted to share another brief case example. Okay, so another patient we worked with, actually a colleague of mine worked with, but I really wanted to share this video. The patient who was, I believe he was a World War II veteran with COPD. He was someone who had been a former tap dancer, and after being admitted to hospice, was so lethargic and not always responsive. But his daughter noted that when he listened to music, he would show a much bigger response than to most things, not really to the TV, just, if she would put on the right music, she noticed that he would kind of perk up and talk a little bit. And so the music therapy department was called in, and I have another video of an intern who was able to help him reconnect to the music of his youth. I just want to note, he lived up in Harlem, and his daughter kind of would note how the Harlem Renaissance provided like a spiritual reprieve almost for veterans coming back, African-American veterans especially. And so the music that we played was from that time. So if I can just pull up one more, bear with me. So you could see as a dancer, he would just really he would dance with his arms. He could no longer tap dance, but you could see his feet moving there at the end. And yeah, so the music therapy again really became central to his care. Was the one visit during the week that he really looked forward to, and of course, it provided an outlet for the daughter as well, who would, though he would get fatigued with speaking, she would be able to kind of reminisce for him, remember those memories that he had shared with her, and that would kind of get the flow of the session along with the music. So it was really beautiful. We had a couple of interns who worked with him, and one of our other therapists, Meredith Farrell, worked with him for quite a while. So really beautiful experiences that we've been able to share over the years. So that will do it for my portion of the presentation. Thank you so much. And I will now introduce Danielle Lucier, who is one of our current music therapy interns, working out in Queens and Nassau County. Thanks, Danielle.
Great. Thank you, Charla, so much. And thank you to Ashton and Toby for having me. I have been interning at MJHS since September, and I've had the privilege of working with a couple of veterans at this point. And one I built a very strong therapeutic relationship with. He was 97 at the time that I was working with him, World War II veteran, and he was living in an assisted living facility. He was referred to music therapy by the social worker because she had found out that he had an extensive background in music, a very accomplished violinist, and that he may need some increased socialization at the assisted living facility. So when we first showed up there with my supervisor, Yuzuko, he was a little bit aggressive at first. He was very combative with the staff. However, once we started doing music therapy, we noticed a complete change in his facial affect, his expression. He and I worked together for quite a few months, and we started to build this bond. We would improvise music together. We would do songs from his youth. We would do some Yiddish music, which he spoke Yiddish as a child. So we had a very, very rewarding time together, and he started remembering things. He started having increased trust. He was able to make connections, not only noticed by us in our visits, but also with the staff at the assisted living facility and with his family who would come and visit him. So I was very, very honored to be able to honor him with Toby and Ashton in a veteran honoring ceremony. And at that ceremony, we sang this song, which I'm sure most of you know, and if you do, please feel free to sing along. But I figured we could close our music therapy portion with a little bit of music with America the Beautiful. Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesties above the fruited plain. America, God shed his grace on thee, and crown thy good with brotherhood, from sea to shining sea. Oh, beautiful for pilgrim feet whose stern impassioned stress a thoroughfare of freedom beat across the wilderness. self-control, thy liberty in love. Thank you. I'll hand it back to you, Ashton.
Oh my God, that was remarkable. Holy mackerel. Got very emotional there. That's just such a beautiful ending to a beautiful program. The gift that you're giving to these veterans and these families is so powerful, and just touched me deeply. And the veteran you're talking about, music saved him. He was scheduled to go to the Battle of the Bulge, and the commander's wife got engaged with him while he was in line, started talking about music with him, found out he played violin, and he ended up becoming the first violin in the Army band and not going to the Battle of the Bulge. And it's just, music is such a special art form. And I love music so much. But anyway, I'm so moved by this program. I'm so glad that you did it with us today. There's just so many stories, and we've just touching, it's the tip of the iceberg. There's so many more. I mean, I've gone with you on other veteran ceremonies and sang songs and seen the power of just the change in a patient, dementia or no dementia. They just come alive, and their families come alive, and they reminisce and share these memories, and it's just awesome. Marlene shared something in our chat earlier, and I just wanted to pull it up here. Where is it? This is so heartwarming. I was at a music therapy program, and they told of a man confined to a wheelchair. When music was played, he would get up and dance with his wife. The music would stop, and he would sit in his wheelchair again, unable to walk. Music touches so much more than we give it credit for. Had to share that. We do have a question. I know we've got about 10 minutes left. If anybody else wants to share a story or question in a Q&A, please do so. There was a question from Obi, which is right up my alley. What do you think of hip hop and rock and roll and R&B as music therapy? I'll pass that to you, whoever wants to tackle that one.
I will answer that. So one thing that you may notice is that we always cater towards patients' favorite music. We always research that by asking the family member, what is the special song for you guys? What is the type of music that your husband used to sing? And also we go by age group. So if the patient is 100-year-old, we will gauge towards, minus 80, and so that the teenage era, like what type of music was popular at the time. So definitely there is no limit on what kind of genre we play, because this is not for us. Music is for our client. We always center around the client's needs. R&B and hip hop, rock and roll. I don't have a lot of experience in the psych hospital. I used a lot, but now age group with the hospice care, we mostly work with elderly people. So, but I think we have no limits on what type of music we use.
Super.
If anybody have any addition to it.
Well, if
Yes.
nobody
Can
else
I
wants
just
to,
Charlotte,
say,
do you
I want
have
to
any?
share something that when Ashton and I were with Danielle in the assisted living facility, it wasn't just the patient that came alive and the family that was moved to tears. There was a whole audience of residents in that senior living center that were all singing along with you. And it opens up a whole conversation among others who had family members that served as well. It was incredible. It lifted up the whole space. So thank you for what you did. Always, all of you, every day.
and not only that, Toby, it was the dementia ward. So everybody in there had dementia, and they all sat there patiently. We started a little later than we had anticipated. There was a good dozen patients in there. And it was remarkable. I just couldn't believe it. And they were singing along, and you
He
played La
started playing.
Bamba. You
He
played
started
such a
playing,
diverse,
what did
yeah,
he take? He was,
a tambourine, a little drum. Yeah, it's so powerful. I don't know if our audience knows, but the VA has a creative art program. They do have credentialed therapists in art therapy, dance, movement therapy, drama therapy, and music therapy, of course. And I spoke to somebody that's involved in this program she was staying at the Queen's VA at that particular time. She shifts around, but she said there's approximately 110 music therapists working for the VHA. That's the Veterans Health Association. So VA medical centers across the country. So that's remarkable. And this all dates back to, Yuzuko was sharing earlier that this dates back to 1945 when they were trying to treat patients from World War II and discovered that music therapy is a really good way to try to reconnect veterans to their previous lives and for healing. They actually have an annual contest. Marguerite, would you like to share a little bit about that? Because you brought that to my attention too. They have an annual shindig
Yeah,
of sorts.
I think what we found out is they, at the VA centers, they try to identify patients that kind of have some kind of musical or art talent background. And with the support of, the recreational department, which is mostly made up of the creative art therapy professionals, and they work hand on hand with the veteran, and they produce artwork or music, songs, or help them gain their voice again to be able to sing. And then they kind of do a contest, and then it becomes a national conference. And as someone gets selected, I'm sure I don't know how many people get selected. And then they actually, vote on it. They select some winners, and then they bring them together at a national conference to kind of showcase what it is that they, the artwork or the music that they did. So it's pretty remarkable, the hidden talents that so many people have. And again, the beauty of being able to recreate something at a different point in your life too, because we all evolve in our lifespan as we get older and things. And sometimes we have to reawaken, things that really brought us joy in our earlier days. So I think that's another portion of it too. So music and art does that.
Definitely. I actually attended unveiling of an art exhibit at the Manhattan VA a few years back from a World War II veteran, and it was pretty awesome. So a question for people who aren't veterans and they're interested in music therapy, where would they look for these kinds of services if they're not in palliative care or just interested in trying to get connected with the music therapists?
There is a website for the National Accreditation for Music Therapists, the AMTA, American Music Therapy Association. Their website is www.musictherapy.org. And they do have a directory where you can, access the board certified music therapists who are in your local area and then reach out that way.
And also, I think you could reach out to your local Veterans Affairs hospitals and clinics to see whether they have outpatient program or community groups or drum circle or some sorts. So you could directly contact with the VA hospital as well.
Mm-hmm.
Do we have any closing thoughts from our panelists today?
Just thank you, Ashton. I feel so honored to be with this special group of people. I really do hold veterans close to my heart. And it's been such an honor to be able to share some of these experiences with a wider audience. So thank you so much.
Ashton, can you read the comment from Becky?
Yes, I was
Washburn?
just about to. Yeah, we're getting a couple of late comments in here. Okay. You're welcome to, okay, I'll do it. Hello. I just want to say thank you to MJHS and Ashton for connecting me to you. My husband, a Vietnam veteran, and I loved his music therapy session during palliative and hospice time. He had dementia. He passed away 9 months ago. I was his full-time caregiver at home. VA didn't furnish this. His local palliative hospice, home health organization, Allied Services, and Wilkes-Barre, PA connected us. Thank you for a magnificent program. Well, thank you, Becky, so much for sharing that. It means a lot. And I see that Janine, it's a nice shout out for you too. Thank you, Ashton, Marguerite, Charla, Izoko, and Danielle. You make all the difference to us. Marie Miller, oh, we're getting such nice feedback. Marie Miller, thanks so much. Great program. Nick Smith, just wanted to say thank you to everyone presenting this. It's informative and inspiring. I agree. Awesome. So awesome. I thank you so much. I knew it was going to be great, but it's even greater than I expected it would be. I even cried. Oh my God, it was so moving. You're brilliant, all of you. And I thank you so very much, all of you, for joining. Thank you to our audience for taking the time to be with us today. And we will soon have another Vet-to-Vet Cafe next quarter. And we're looking forward to bringing you something new. Have a great rest of your day, everybody.
Thank you.